And liposuction is not for everybody, but it certainly is an option. Dr. Mark Schusterman is here to tell us about the newest version of lipo. Good morning to you, and thanks for being here today.
My pleasure.
Smart lipo. It's the rage these days, it seems.
Yes,
what is that?
Well, it's a new form of liposuction where we actually use a laser to help break up the fat. Not only does the laser help break up the fat, but in this particular model of liposuction, or smart laser liposuction, there's actually 3 types of lasers at 3 different wavelengths, so that it can not only break up the fat, but also generate heat so that there's a lot more skin retraction and skin shrinkage.
We're watching video right now of the procedure. Now, what we're seeing right now, is all of that happening at once? Is the laser light inside the wand, or does that happen at different times?
No, the laser is inside the wand, and the wand itself has a fiber optic cable going through it. There's a machine, a generator, that actually creates the laser light, and the laser light can be, as I said, has 3 different wavelengths, and it can be mixed in any type of mixture that you want in terms of the type of wavelength that you want to use, depending on what you're trying to accomplish. And at this point, again, what you're seeing is the laser being applied to the fat.
So, like so many other procedures, lipo has come a long way. So is this something that you just come in, the patient just comes into the office and they leave the same day?
Correct. They come in the same day. We actually give them some fluid, which makes them numb. Basically, it has some lidocaine in it, and it also has some adrenaline in it, so they don't bleed as much. And then what's more, the laser itself has a wavelength which is absorbed by blood cells, so that in turn helps minimize the bleeding. So there's less bleeding and bruising with this. There's better recovery. I wouldn't say faster, but it's more comfortable and less swelling.
What about anesthesia? Is the patient awake during this?
Awake the whole time.
And so they can hear and know exactly what's going on?
Well, what we can do, which has really been helpful actually, is that we can get them to stand up after the procedure, look at the areas that they have in concern. They actually go to a mirror in the bathroom and say, well, could you take off a little more hair?
Oh, that is convenient
for
them.
So it's been really helpful.
Certainly, it's gotten so much more popular, but are there risks involved? What would those risks be?
Well, there's a risk with any procedure, obviously, but I think the biggest risk to the patient is having the procedure done by someone who's not a board-certified plastic surgeon. And obviously, if you go to somebody that hasn't been trained well in any type of procedure, whether it's liposuction or anything else, I think you run the risk of getting an inadequate result at the least, and perhaps injury at the most. So
everyone always wants to know how much the cost is. How does this compare to the older versions of lipo?
It's actually less expensive than the older versions of lipo, because you're not having to pay for anesthesia and the OR fee and that type of thing. So it's actually a real value for our patients.
Well, everyone always likes to hear that, especially during those tough economic times, right? Dr. Schusterman, so good to talk to you. Thanks for being here today. And now we know everything we need to know about smart lipo.
There you go.
Appreciate your time.